Welcome. I'm Ron Baker, Director of the Canadian Small Church Ministry Center, and this is Us, Canadian Small Churches in Action podcast sponsored by Small Church Connections. Today's guest is someone coming to us from, as I often say, the other side of, well, almost our world, at least the other side of Canada or halfway there. We'll call Ottawa and that area, well, we'll call Ontario somewhere else other than where I'm coming from, which is Saskatchewan. And so I'm going to let our guests introduce themselves and just give a little bit of their background, and then we're going to pop right into a whole interesting question that's part of our Canadian cultural society nowadays. So without talking anymore, let's just, what's your name? A little bit of background, and let's go from there.
Yes, hello. My name is John Scott, and I'm a physician who's been in palliative care since 1975.
Okay.
So, and in addition to that, I was trained in theology and was a Presbyterian minister for 20 years, and then actually became a Roman Catholic layperson and have stayed very active in the church since. I'm quite active with the Christian physician community and the Canadian Society of Palliative Care Physicians. And I think you've already met some of the other physicians in that group. So
yes, I have, and rather enjoyed chatting with some. So, okay, let me just jump right in to palliative care, and let's ask the question of you were in on, I guess, what you would call the beginning stages of making palliative care in Canada an outright thing. Hey, this is happening. We need to talk more about end of life type of things. What started that sort of movement that you came into, and where has it gone along the way?
Well, it all started in 1974 in Montreal.
Okay.
It was, I was a kid, you know, a young doctor, still wet behind the ears. And I just happened to be the right place at the right time. Obviously, I see it as being the Lord's timing. And I became a friend of this physician, Ina Cummings, who would become the first clinician to work in what this new field was being labeled as palliative care. So Dr. Belfer Mount was the surgeon who was the one who really started this whole program, but he first hired Ina and then hired me to do the day-to-day clinical work for patients. And we were both sent for periods of training to what was going on in England. So there was a famous hospice in London, referred to as St. Christopher's Hospice. And Dame Cicely Saunders, who's viewed as the founder of this whole movement, was still very active. So I had the privilege of meeting all these sort of founding pioneers and know them. And of course, all of them were active Christians, which is not often talked about, but was, I think, very much part of why I got excited.
Right.
Because I could see this as an important mission. We felt that the Lord was pointing to the neglect and the possibilities of caring, but also teaching people what dying was about and what it should be. And so there was a sense of excitement about both the medical possibilities, but also the spiritual ones in this new movement.
Yeah. Well, and as it grew, what other influences started to come in from the society? Were you sensing that this was the right moment, as you have said? What was happening that really pushed some of that?
there was a decision fairly early on that the only way we could serve the larger population was to reach beyond the small sort of hospices that were run as
Right.
Christian organizations and secularize it so that it would become embedded in the whole healthcare system,
Right. Yeah.
knowing that that would risk diluting and taking away some aspects of it. Certainly, we were allowed to talk about spiritual care in a way that other parts of healthcare were not. It
Mhm.
was somehow seen, because the patients were dying, it made more sense that we could keep spiritual care as a key part of our philosophy. And that, I think, was important and lasted for many decades. I mean, there has been a gradual secularization and some of the other things we would have seen in our society. But in many ways, I feel like the palliative care movement has slowed the progress of what was happening in the rest of society, and certainly towards assisted dying, it slowed it down.
Well, okay, I'm going to go into a bit of my own background and that type of thing. I came on as a pastor in the late 70s, and in one way ended up with my own grandmother being one of my contacts. I will say that, as she is passing away, one of the patients that I had opportunity just to be with. I think at that point, palliative care and even pain management and a number of those things were not as effective as perhaps they have been today. And sometimes the visits were more painful, quite literally, for both of us. How has that changed, that whole approach, since, let's say, the late 70s till at this point? If I were to go into palliative care in a hospital or in a hospice, how would that be different?
I mean, I think there is an ongoing problem of the fact that good palliative care is not still available widely across Canada. It's very spotty,
Okay.
and depending on the part of Canada you're talking about, or even the year that you're talking about, you may or may not have access. And that's part of an issue of why it's also relevant to the issue of medical assistance in dying, in that we are promoting a last resort type of option in our society when we haven't done the work of actually providing the care we know works and can bring about a control of those physical sufferings. So I don't want to say that palliative care is right now handling all the problems. It's not, because we don't have the resources given to us.
Well, let's just jump off on that, and I'll talk about. I live in a small town. Good pastors and ministers here in town. We have a hospital. Not all rural centers close to us do, but we have a hospital. What could we be doing as small church pastors to either promote, to move into the whole area of more effective palliative care? And I'll have to say that our town, this particular town that I'm part of, sees palliative care as important. Is there any way that we can promote? Well, I'll let you run with some of your thoughts as to what we can do with that.
I mean, it sounds like you already have a lot of the elements that I would think are important. So you've got a group of people who recognize it as important, and you also have the nuggets of active community who want to help with this and are just really trying to find out how better to help. I mean, certainly having those small communities, I think, are critical. Like in the big cities where there isn't that community, it is horrendous in many regards. The loneliness and the lack of people. Thousands of people are in their houses and no one knows that they're there. And the system, the healthcare system that's supposedly helping them, is decreasing in terms of hours of care every year. We're giving less and less care per patient
Mhm.
every year. So that's the reality of the next 10 years. So if you're wanting to have good palliative care,
Yeah.
you have to mobilize non-governmental resources to supplement whatever the government sources can do.
Mm.
And so it's not just thoughts and ideas, it's also activating active volunteers to help. And usually smaller communities are good at that.
Yeah. Yeah.
And if you give them the story of why this is important, they usually go after it. And it's often organization, but it's also teaching. I think the pastors have a huge role, yes, to encourage loving, energetic communities,
Yeah.
and demonstrating that in their own, but it's mostly, I think it's feeding the ideas, the spiritual care, being able to show how those fit together. So the work of the church is both the bedside care, or the cutting the lawn, or the taking people to doctor's appointments, but also the pastoral care, the listening, finding out that they're in some dilemma. You find out that the old lady next door has a grandson who's pushing her to take medical assistance in dying.
Yeah.
So that you find out about, and you have to then mobilize the supports to try to help her, to try to give her more information. That type of thing is far more likely to happen in a smaller community than it is in a large one. I think certainly fear of this whole area
Yeah.
of dying is a huge thing that keeps people wary of jumping into this. They feel like maybe someone else can do this, but I'm not sure that I can. And it's often just gently and in repainting, reframing what that dying experience is like, often with biblical stories. So, I often go back to Simeon and the story of the Christ child being presented in the temple, and Simeon, this old man,
Yeah.
waiting to die, but having felt strongly that the Holy Spirit had given him the promise that he would see the Messiah before he died. And there's this wonderful image of the most important moments of his life occurred at the end. It made all sense. It brought it all together. And that kind of image of what our dying can look like, that it isn't less and less life, but it actually can be an explosion of meaningful life. And it also, of course, the Simeon story is a wonderful one of talking about when do we say no to some aspects of aggressive care. There's a letting go, a recognition, yes, this is now the time, and to peacefully relinquish. And to me, that also is a kind of teaching that pastors have the opportunity of doing, because the danger in this era, I think, is almost that everyone is so against, in Christian circles, so against medical assistance in dying, that we feel that any stopping of any kind of treatment is somehow like that. It's giving up, it's wrong, we mustn't do that. And that's not the Christian view. The Christian view would be that when our bodies are dying, that is not something that we struggle and grasp for more hours or days, that we can relinquish. And I think that is both sides have to be taught together.
You've hit on something that, well, let me just say, I sat in a ministerial recently where the topic was brought up about MAiD, and particularly more along the line of, oh, it's happening. Yes, it is happening here in small town, and we have it here. And then the stories began to arise. And my story is one of those stories where my first wife was on life support, and the question of relinquishing felt like the question of saying, well, now I'm turning it over to the doctors just to extinguish a life, instead of saying relinquishing. So you've started a topic here that I'd love to hear just a little bit more about your thought on that whole area of relinquishing.
Mm-hmm.
You've got a good start. I've heard, very good thoughts, but yeah.
I think it also speaks to me when you mention your experience, how when we're dealing with physicians
Mm-hmm.
who are trained in a certain cultural mindset and have a vocabulary, Christians are suspect of sometimes what they're offering.
Mm-hmm.
And they assume that when they say certain things about, they might ask the question, when someone is critically ill and really on the edge of dying, they will say, would they want to live with this quality of life? Well, a Christian often, that's red flag.
Right.
They're talking about quality of life as if somehow someone who has a lower quality of life isn't as fully human as one who doesn't. And we immediately say, no, I don't. Obviously, whatever he's suggesting is not what a godly person would say. And that needs to be parsed. It needs to be understood that that's actually not. The code words aren't correct. He is actually afraid to say, this doctor is afraid to say, your wife is dying.
Right.
And all we're doing is prolonging this situation. Out of a whole set of reasons, physicians find this very hard to say. And so their advice may in fact be absolutely the best advice, but it's coming out in language that makes us suspicious. And I find that Christians sometimes make the wrong decisions because they aren't understanding the real story. And I think pastors can help. Obviously, they don't know the details of each case.
Right.
They can try to listen, but almost along with perhaps Christian doctors and nurses in the community, if there are any, to arm people with questions. What are the questions to ask?
Mm-hmm.
And a lot of them are to do with prognosis. Do you think, how close are we to death with or without this treatment?
Right.
And if they did get intubated or did continue with a ventilator, what is the likelihood that we'll get out of this?
Mm-hmm.
And they'll hum and haw, but they usually, if pressed, will tell you. In a sense, what are they saying out in the nurses' station to their colleagues? They're afraid to tell to you, which, because it's not because they're purposely trying to be difficult. It is actually a spiritual, emotional problem for the physician, because all of us go to a place of guilt when death is present. So I would say dealing with and trying to parse that issue of guilt is an important part for a pastor. And a pastor can also feel guilty. Somehow I haven't done enough. This person went ahead with MAiD, and I guess I didn't pick it up, and I didn't say enough, and I should have made that visit last week, and all of that. We all go to a place of guilt, and so does the doctor. And they try to remove themselves so they don't take on the responsibility of giving the prognosis and burden the family as a result, and make the family feel that they are making the decision whether this person lives or dies.
Right.
When in fact, as a palliative care doctor, I'm in this conversation all the time. and I'll sort of take my turn after the surgeon or the other internist has said something. And I said, I think what the doctors are saying is that your family member is dying,
Mhm.
and they're nodding. The other doctor is
Yeah.
nodding,
Yeah.
even though that's not what they said, but I knew what they were thinking.
Yes.
Now I mean, that may actually make people listening think, oh my goodness, well, how can I ever
How do I
navigate this system?
exactly. Yeah.
It is, it is, I think in many cases, it is family members who just ask questions gently, calmly, who are not seemingly grasping for more time.
Mhm.
You will get an honest answer if you just gently persist. Um, and the, and if you explain even your philosophy, like, I don't necessarily want to prolong dying,
Mhm.
but I would like to know whether you think there's a significant risk that if we get through this crisis, we will get back to a place close to what they were like before.
Mhm.
You know, again, it's a lot to ask of a family, um, and to be able to do that. But in some ways, if someone in the family, not necessarily perhaps the most bereaved at the moment, most
Mhm.
but someone else could, or even occasionally a pastor going with a family. I mean, that
Yeah.
does happen sometimes
Mhm.
and can often be very helpful to have the conversation with the physician. Um, uh, that
It's certain
second set of
there's
ears.
yeah. Yeah, there's this whole and I guess pastors get to deal with the grieving afterwards. And there is a sense of guilt, as you say, that's constantly there, it
Mhm,
seems.
mhm.
And if there had been upfront talk, a very frank discussion, I think the guilt would not be as deep. Or I mean, we seem to gather guilt easily, but nevertheless, I think maybe what you're talking about is just being frank, being upfront, push to push to hear what isn't being said. And that's very difficult. As I say, my first wife, born with a congenital heart defect, lived to be 58 years old through the help and grace of God and the help of the physicians. But her learning along the way was constantly push the doctor to actually tell you what they're going to tell you. And that, I think, gained her years in her life because she was quite open to that, but also at the end made the decision much easier just to say, this is it. This is as far as we can go. I think we're at that point. Um, are you seeing some of that? Well, you've worked in pastoral position as well as a physician. What Okay, I'm already hearing what you're saying. Explain a bit more. Talk a little bit more about that. Some of your own personal thoughts on that.
Um, well, in terms of a pastor, in terms of a pastor at the bedside, um, when someone is sick to
Mhm.
the point of actually being in bed most of the time,
Yeah.
versus a pastor perhaps earlier on, during when a diagnosis is being understood and the severity of the illness is being appreciated by everyone. There's different points in the, but normally the most important thing, the messages we want to hear
Mhm.
is the messages from God, and sometimes the same messages from our family, that I love you. They want to be reassured of God's love,
Mhm.
of his forgiveness, of um, his delight in them, his
Yeah.
pride in them, in the best sense, um, that he will not leave them, that he
Mhm.
will be with them. And those words, be not afraid. I mean, those kind of basic, wonderful things from Scripture communicated through the pastor are so powerful. I
Yeah,
mean,
yeah.
there's nothing more important that we don't have to have fancy psychological training to do some of that. It doesn't hurt, but we don't rely on that mostly. It's
Mhm.
very basic, and especially as people get very sick, their intellectual ability, they're even able to understand words, are increasingly decreased.
Mhm.
So we actually begin to communicate those messages in our actions. Yes, we say them out loud still, because probably hearing is one of the last senses to go, but we are, in a sense, by our very presence,
Yeah.
bringing all those messages um, to the bedside. And obviously that was so difficult during COVID when we weren't allowed to.
Oh, yeah.
So it, um, I think as a pastor and in a small community, we're going back to what we can do about it. I mean, some people have decided to fight this politically, and
Mm.
I have too. Um, but after several years of anger and frustration and trying to grasp control of something that I had no control over, and feeling a deep grief um, and discouragement around what was happening in palliative care, um, I sort of feel that we need to go back to, okay, there's a new environment here.
Mhm.
It doesn't mean we don't stop political action, but we put our focus on what God's call for us is. So the shepherd
Yeah.
is to keep his flock together. It's to guard them, protect them, and realize there will be some that rush off and they will need to run after them, but sometimes they'll fall off the cliff and they can only do so much. And their job is this is the new a new environment.
Mhm.
And I sometimes even say to myself, what if we somehow, God took us and planted us in another part of the world that had a different culture and a whole different ideas about death and dying? The Lord would want us to evangelize, to get to
Mhm.
know those people, to accept them where they are, and even know that God loves them,
Yeah.
and not take it as somehow they're doing this to hurt us. And of course, the whole fortress mentality of Christians gets caught up. I was caught up in it. I think I
Mhm.
obviously sometimes are all the still, but I mean, I think some resistance to that mentality,
Mhm.
and there are so many things we still can do.
Yeah.
It is a privilege to take care of those who are close to death.
Yeah.
It is a holy place. It's a holy time, and people are being healed, are being reconciled, are passing on wisdom. Like,
Mhm.
this is not, yes, there is suffering. But it's like the labor of birth. It's a difficult time that's full of meaning.
Yeah.
And we should teach that and demonstrate that. And um, and I think that's an evangelistic tool.
Mhm.
How we die will be something that people will take note of
Yes.
and come to the Lord because of it.
Mm. Okay, our time is pretty well up. Unfortunately, I I feel like I could use another hour or so here, but or maybe just do this again at some point. But if if I were to take one last question, what advice, if you had one piece of advice you'd give to a small church pastor as they work into and are part of this cultural moment in Canada, is there just, well, just one piece? I think you could have many pieces, but is there one piece that you would sort of throw at us?
Um, the one I had planned to say when you said you were going, I've already said. So
Okay. Well,
I'm
well,
trying to rethink about what would be the most important. I think um, even for themselves to actually let go of the feelings of potential guilt or potential I'm not doing enough, and actually allow their interaction with the dying patients in their community as a gift from God to them, and see those people as Christ in disguise, that they are serving and they are going to get something from it. And if they are treating that part of our community that way, everyone else will follow them in their example.
This is great. Thank you, John. I appreciate this much more than I had expected. I shouldn't say that on a podcast. We've done, but I have just appreciated this very much. So thank you. And we'll let people know about what you've said. And I appreciate what the direction you've given. This is great. So thank you very much for joining us.
Very good to meet you. Right.